Thank you, Michael. It's a pleasure to be here to talk about the LENSAR system. My disclosures, I've been a clinical investigator for LENSAR, and I believe we performed the first femto cataract surgery in Asia back in November 2009. And to date, I've performed about 1,000 femto cataract surgeries. So the evolution of cataract surgery has paralleled the evolution of human history. We started doing things manually, and then we learned to use simple machines, and now we're entering the age of computer-controlled automation. The combination of image guidance and what Ron Kruger likes to call the femtosecond ophthalmic scalpel has now provided surgeons with unprecedented levels of precision in performing the steps of cataract surgery. So over the next few minutes, I'd like to introduce the LENSAR laser system. It's a compact ergonomic machine. The surgeon controls everything by means of a joystick, and it occupies a very small footprint, and you can move it from one location to the other. We'll go over the features of this machine. So there's a video here. You see you apply the patient interface device, and you fill this with fluid, and then you dock the eye to the laser, which then performs a series of several scans. And then these scans generate these high-resolution images of the anterior segment. These images are then used to create a three-dimensional construct upon which the treatment algorithm is superimposed. The surgeon, if satisfied, then activates the laser to perform the different steps programmed, like capsulotomy and fragmentation and corneal incisions. Afterwards, the patient is then brought to the operating room where he's prepped and draped. So here you see the machine being removed, prepping and draping of the patient. Then you do the entry into the eye. You use blunt instruments to enter the incisions. And then you remove the very nicely cut capsular rhexis. And you see the pie cut pattern treatment that I like to use, because this allows me to pre-chop the nucleus into several parts, and I found that this is most effective in my hands in reducing the amount of ultrasonic energy used. So you can see that in this fairly moderate cataract, we only use about 0.81 CDE on the Alcon Infinity machine. And after you remove the remaining cortical material, you see this very nice, well-cut capsular rhexis through which you can insert your intraocular lens. And you see a very nice coverage of that lens. You just leave a little bit amount of capsule to cover the lens. So in over 1,000 cases, we've seen pressurized a maximum of 30 millimeters mercury, and we've had no perfusion loss in all of these cases. And how the LENSAR machine differs from the other machines is that it uses high-resolution shine plug imaging that generates these very nice, crisp images of the anterior segment and the cataract. And what's the benefit of these images is that they can help the surgeon assess cataract anatomy, cataract density, and subsequently choose the best surgical technique that he feels is good for that particular patient. So to illustrate this, here's a case of a dense cataract, but as you can see, there's actually a area where you have cortex between the nucleus and the capsule. And through this area, you can insert a second instrument, like a manipulator, to perform the counter pre-chopping procedure, and this helps you with the nuclear disassembly. Now, this other case is very different. You see a dense cataract, but there is no cortical space. So in this case, the imaging tells you it would be dangerous to try to get an instrument into that equator to do the counter pre-chopping. So here you might want to try another technique. This is a case with a moderate cataract. What we missed in the clinic was that he actually had a posterior polar cataract, which we saw on the image. So once we realized this patient had a posterior polar cataract, we adjusted our machine settings and our technique to perform a successful surgery. So in addition, the imaging system can generate all these nice images of the cataract and help you assess the cataract density, how hard that cataract is. And you can use this information to program your phaco machines and choose a setting. And we found a very high correlation between the imaging grading of the cataracts with Lux regrading. There was a high correlation with the image grading of the cataracts with the amount of ultrasonic energy we used. So just like the other lasers, the LENSAR machine can also cut that anterior capsulotomy. You can get a very nice, consistently sized and shaped capsular button. But what's the advantage of having this well-cut capsule? First of all, we seem to see a trend towards not having as much PCO. We haven't had to YAG any patient in 3 years of doing this procedure. Also, a well-cut laser anterior capsule also tends to produce less absolute deviation from your target spherical equivalent. We're also getting better refractive outcomes when we do laser anterior capsulotomy as compared to manual rexis. More patients would achieve plano or within quarter diopter of target. And of course, the laser can be programmed to cut the nucleus into any pattern that you want. We tested several patterns early on, and in my hands I found that the pie cut pattern is the most effective. And even in harder cataracts, we find that there's a reduction of used ultrasonic energy by about half. What about safety? The LENSAR system gives you some safety features as well. You're able to program the machine to create a epinuclear plate between the posterior capsule and the nucleus, which protects your capsule from damage while you're doing the nuclear disassembly. And that plate can be removed at the end of the surgery. We've also found a trend. There's a trend towards less endothelial cell damage using laser lens fragmentation as compared to conventional phacoemulsification. This is likely a result of reduced ultrasonic energy. So patients who underwent conventional phacoemulsification were found to have up to 4 times more endothelial cell loss compared to patients who underwent laser lens fragmentation. So femtosecond lasers are more than just cutting instruments. We're finding out that these high-resolution images gives the surgeon very useful information to help them go to the next step, which is to remove the cataract. You get information about the lens anatomy and the cataract density grading. And I believe in the future, these femtosecond machines with their imaging and cutting technologies will be similar to what the MRI does for the neurosurgeon. It guides them in doing the surgery. And in the future, I believe also that these the data for images will be used to automatically program the femtosecond laser parameters as well as your phaco machine parameters. So the technology is continually evolving. The LENSAR machine has gotten an approval for clear corneal incisions, and we're doing an ongoing trial on astigmatic correction. And we're also continuing our interesting work on using the laser machine to restore accommodation. And we've done initial studies in ATIs that demonstrated up to 1.5 diopters of accommodation restoration. And interestingly, even when you use the laser to cut these middle-age cataracts, we haven't seen cataract formation in up to 2 years. So in summary, the LENSAR imaging provides images that can guide surgery. The lens fragmentation algorithms lessen phaco energy and endothelial damage. Laser anterior capsule produces good refractive outcomes, and restoration of accommodation is a promising non-invasive capability. Thank you very much for your attention.